Greetings to viewers. I am Dr. Pradeep Kumar, practicing at Brookefield Hospital as a senior consultant physician with my areas of interest in cardiodiabetology, critical care and emergency medicine. As all of you are aware, there has been a rapid surge in the number of cases of coronavirus infection the world over. First of all, what is this coronavirus? Coronavirus is a group of virus, the respiratory virus. It derives its name because of the crow-like tentacles that is there on the surface of this particular virus. This is a respiratory virus similar to the severe acute respiratory syndrome, which is called as a SARS virus. The name of this particular virus is COVID-19. It is so called because of its name from the group, which is the coronavirus, and it was identified in the year 2019 in December. The reason for this virus to be very critical is it affects one of the critical organs of the body, which is the respiratory system. When it affects the respiratory system, it's got a specific affinity for the respiratory cells, and it causes what is called as a severe acute respiratory syndrome, which results in breathlessness leading on to critical illness and patients succumbing to this illness within a short period of time. This virus is got a lesser mortality rate as opposed to the previous viruses that we have come across in the past. How do we identify the signs and symptoms? You have a whole lot of literature that is available all across in all medias and especially in the social media. But as a treating doctor, what is it that we need to be worried about, and how do we identify or differentiate a person who could possibly be having a potential coronavirus infection as opposed to a common cold and a common infection that every one of us would possibly encounter with? The first and foremost point that we need to consider if it is a coronavirus infection is the travel history. If the person has traveled from any of the affected nations across the globe, he or she has got a high chance of coming in contact with this particular disorder. Now that you have suspected, what are the actions that you need to take? The simplest precautions that you need to take are what we call as universal precautions. Those universal precautions are greeting people with a namaste, which is the Indian tradition, and avoid shaking hands, and following a cough etiquette. When I mean a cough etiquette, people need to ensure that they do not cough without covering their face and wearing a mask if in case a person has got certain symptoms. The specific lifespan of this virus is expelled out of an infected person. The virus can travel up to a distance of 2 meters. The virus, because of its heavy nature, it tends to settle down onto the surfaces and it's not spread across in the air. How long will these viruses last on a surface? It can last close to almost around 18 to 20 hours on a given surface. So the precautions that we need to take is stay away from an individual by up to 2 meters. If in case you come in contact with any of the surfaces, ensure that you hand sanitize yourself using the regular disinfectants that are available. Who is supposed to wear these masks? If a person is having any of these symptoms, as a precaution to prevent spread to other people, that affected person can wear it. The other, if people are suspected or immunosuppressed and people who are belonging to the extremes of age groups who are vulnerable to this particular disease, people who are pregnant, they are the people who can wear this as a preventive disease because they can acquire these infections very easily if they come in contact with any of these patients. Now, how do we do a hand sanitization? It's a regular conventional method that all of us are used to. Make sure that you keep using these sanitizers as and when you touch any of the common knobs, the door knobs, the railings, when you go to public places, any of the places, the tabletops, the hotels that you visit, any of these surfaces, if a person has coughed and has got the virus, it could stay there for 8 to 10 hours, and that's the reason why you need to make sure that you hand sanitize yourself. Now, what if you have these symptoms? What do you do if you have the symptoms? Do not panic. Please reach out to your doctor. Please explain to the doctor about the onset of symptoms, about your travel history, about the kind of persons that you have come in contact with. This is the only differentiating factor that the doctor would want to seek from you to identify or suspect a potential case of coronavirus infection, because all the signs and symptoms are similar to that of a regular common cold and infection. What would the doctor do if he suspects a case of coronavirus infection in a given individual? How do we take precautions? As I told you, follow universal precautions, follow cough etiquette, follow hand hygiene, and ensure that you do not panic. Keep safe, keep healthy. Thank you.